Forget about the election. Dr. K and Dr. Mike just dropped the most heated debate of 2024. Let's watch together.
Like, it's hard to judge why things were created in the past. It's hard to even look back at history 100 years ago and try and gauge, like, for example, why I did something yesterday is hard for me to judge.
Yeah.
So I'm wondering how much more difficult it is to judge why someone created something thousands of years ago. So I'm going to pose a question to you to be more specific. Is it possible that the reason meditation was created was to ease symptoms of anxiety, depression, even though they didn't have these diagnoses, and they called it enlightenment?
It's possible.
I mean, isn't it reasonable to say that?
Well, it depends. I mean, do you trust the people who made it? And if they give you a reason, right?
I think that applies in the present or in the recent past. I think when you look back so far, time-wise, their definitions and understanding is going to be greatly different. So they would never have said mindfulness is a treatment for anxiety, depression, because they didn't have those terminologies.
I hard disagree there.
Really? So you think that existed? Like the idea of major depressive disorder, generalized anxiety
absolutely,
disorder?
Right?
Okay.
So we have, for example, like Ayurvedic medicine, which diagnoses mental health conditions, right? So you have systems.
I'm not familiar with that, so tell me about those systems.
Yeah, so you have medical systems. So this is the big thing, is that medical systems would diagnose things like depression, bipolar disorder, stuff like that. And the reason that I say that meditation was not developed to treat a mental illness is because they say that they're like, I invented this thing to help people attain enlightenment, get rid of suffering. And then along the way, you will treat your mental illnesses, but that's not the goal. So the way that I understand it, and the reason I trusted it, because that's what they say, right? So they were very clear about, and then who are we to say, oh, they didn't understand these terms and things like that? I think that's actually sort of judgmental, and I'm not calling you that, but I'm just saying to look back at them and say they didn't know better, they didn't use this language, and we are interpreting what they said based on our understanding, I think is not a good idea. And then on the flip side, we have a comparable text of Ayurveda or something like traditional Chinese medicine. Well, they'll talk about mental illnesses. So they'll talk about things like cerebral palsy or malfunctions of the brain or things like bipolar disorder. And they'll have treatments, like usually herbal treatments and other kinds of things, where they separate these two. One is a rog, or an illness. And the way that I kind of understand it is the use of medicine is to get you from -100 to 0, to remove something that is malfunctioning. Meditation is a process to go from 0 to 100. So you can still increase your number. So if you start meditating at -100, you can get to 0. But the practice was not designed as a treatment. It was not designed to bring people to baseline. It was designed to bring people at baseline to above baseline.
Okay, so you can already see Dr. Mike start to get a little bit confused here in the conversation, where he's like, huh? And it's interesting what Dr. K is saying about getting you from -100 to 0 versus 0 to 100. I don't know that I would necessarily say that that's ultimately the complete end goal of traditional Chinese medicine that he references here. But I will say that I think there's a really interesting distinction to be made here about the goals of medicine practices. So for example, in traditional Chinese medicine, the goal is to bring someone into what we call a balanced yin-yang state, right? When you think about illness in a Western medicine context, right? It's very much about treating illnesses. So when you have symptoms that manifest, they fall under a specific, categorization. You go to the doctor, they help to diagnose, and they give you a treatment to ultimately get rid of your symptoms. And so if you're have no symptoms, like your blood tests are normal, that they run are normal, you're not manifesting anything that's already defined within modern day medical literature, you're considered healthy or normal. In traditional Chinese medicine, I would say the bar for healthy is like way higher. When they start diagnosing you for having issues is like way earlier. But instead of actually focusing on saying like, when you have this symptom, try to fix your body. When you have that symptom, try to fix your body. Like, there is this kind of end state that you try to move toward. For example, when we think about the circadian rhythm, like there's yin yang to describe different hours of the day, such that there is a time for rest and there's a time for productivity. When you think about the parasympathetic nervous system, the sympathetic nervous system, there's a yang and yin to that kind of as well. And so the goal is to say, how do we get the human body as close to yin-yang balance where it needs to be as possible? And by default, naturally, you won't have all these other symptoms that manifest as illness. And so, like if you look at traditional Chinese medicine, it won't say that, you know, the goal of Chinese medicine is to cure A, B, C, D, F, G, X, Y, Z, like illnesses, because there's an endless list of things that could go wrong with the human body. Instead, they say that the goal is to bring everything back in harmony and balance, and here are some indicators of what balance looks like. And anytime there's an illness, we look at what is out of balance. So it kind of creates this sort of North Star that I would say like simplifies a lot of medical treatment. A lot of understanding traditional Eastern medicines is the willingness and ability to understand the underlying philosophy behind the medicine. And so it gets into a very philosophical practice. But the beauty of it is that once you understand the underlying philosophical practices, it becomes very easy to treat illness because all you have to do is kind of bring everything back into alignment. Eastern medicine can actually be a big hack for us modern day humans to just make life a lot easier, right? To say like, okay, I have all these different illnesses, but they're not random. Like, in Chinese medicine, cancer doesn't just develop randomly. Like oftentimes we say, oh my gosh, I'm so sorry, like you discovered you had cancer, or you discovered you had endometritis, or you discovered you had, you know, XYZ illness. Even something like congenital diabetes, right? In traditional Chinese medicine, everything has a cause, right? Everything has a cause, and it's all because something went wrong in terms of balance. And so even if you have a congenital disease, that's considered something having gone wrong in the mother's womb, or you know, potentially with the father's sperm, etc., or the egg, etc. But something kind of was out of balance in the parent's body that then passed on to the child. So, and cancer is something that, you know, ultimately would have been traced back to something getting out of balance very, very early on, you know, years and years and years ago. And so, you know, things don't just happen for no reason, if that makes sense. And I think that that can be a really powerful thing, because that means that a lot of what happens to us as humans in terms of illness can be understood and can be actually treated and maybe caught even much earlier on if we engage it from an Eastern medicine perspective, instead of just waiting for the symptom to develop. Okay, let's keep watching.
How did they describe cerebral palsy 1,000 years ago? And by the way, I'm saying 1,000 years completely uneducated. I have no idea. 5,000 years.
Yeah. So I don't know let me just think about what examples to use. So
because the reason why I'm so skeptical about this is I look at how mental health was discussed in the 1900s of like histrionic personality disorder versus hysteria in women. Like very judgmental, very culturally based at that time. You're saying that didn't exist 5,000 years ago?
No. So dude, East and West are completely different, man. Like it's like night and day.
Okay.
So let me just give you a couple of examples. So like if you look at an Ayurvedic textbook, they had a super cool diagnosis for diabetes.
Okay.
They say go pee next to an anthill. If the ants drink your urine, then you're diabetic.
Okay.
Right? So they had a lot of understanding of physiology.
What did diabetes mean to them? Because to me, it means checking someone's hemoglobin A1C and seeing it fall in a specific range. But if I'm trying to put myself in their shoes, I have no measurements of that. I'm not even aware of bacteria, right? Antibiotics don't exist.
I don't know. I think they have certain herbs that have antimicrobial properties. They understand the process of sterilization. So I think
they do.
Oh yeah.
I mean, we just did a video on the history of the first gentleman who recommended washing hands in between treating morgue patients and delivering babies in
That's
the 1800s.
In the West.
What
Dude.
Was that?
So I want to applaud Dr. Mike here, because I think that As much as, it's easy to criticize someone coming from, clearly a very Western background, and say, why do you keep trying to use your worldview and like force it onto, another history? I will say, I think whether or not he's intentionally doing this, he is making himself very vulnerable right now, because you can tell by the questions that he's asking the way that he's thinking, right? So he's like making a lot of assumptions about what people knew or didn't know in the East in ancient times. Absolutely, they had an understanding of bacteria. They wouldn't use the term bacteria, but they would use the term, for example, like poison or toxins. And in fact, there's like very detailed categorizations of different types of quote unquote like bad things that can enter your body. I would say the description of the pathways is not always going to map accurately to how we understand the ways that people get sick nowadays, or it's not going to be a perfect description always, but they were able to observe a lot of things and actually conclude that something goes wrong. So for example, this is one of the like most common things that you'll hear like as advice when you start to get in traditional Chinese medicine, right? And anyone of Asian heritage or Chinese heritage in particular is going to have heard this from probably their parents, which is don't go to sleep with your hair wet, or don't go outside with your hair wet. Like always blow dry your hair, because we don't want you to have quote unquote cold energy enter your body, right? Because as water, like step out of the shower, you cool, it gets very like cold, all your pores are open, that kind of stuff. You need to not drink cold water. You need to cover yourself up when you go outside, stay really, really warm. It's like a very anti-cold medicine philosophy, but there's a good reason for that, right? As we know, like when your body temperature gets too low, it can actually weaken your immune system, and it makes you much more susceptible to cold and viruses and pathogens in your environment, and that's what makes you sick. In traditional Chinese medicine, they'll describe it as kind of this sort of like dangerous gust of wind energy entering into your body. So is it really wind energy entering into our body when we go outside and don't wear enough? No, right? But there was a fundamental understanding of the fact that like something negative is going to enter your body and make you sick.
I helped organize a conference at Harvard a couple of years ago, and one of my mentors was on the panel. And so this was a conference on integrative medicine. So there were a bunch of like Eastern medical practitioners there, and they kind of asked this question. They said, like, what do you think needs to happen for Eastern medicine to be more widely accepted? And my mentor, brilliant guy named John Denninger, said, you guys need to let your treatments fail. The problem is there's such a pissing contest between Western medicine and Eastern medical practitioners that no one on the East is willing to say, yeah, this treatment sucks. So the one thing that we do really, really well, which is I think why allopathic medicine, the reason that Western medicine is dominated so much is because we are so good at pointing out when our medicine is wrong. So if you look at things like thalidomide or, like that's such a great example of, oh my God, revolutionary medicine solves nausea. And by the way, we're never going to use it ever again, right? And so we're really good at that. And the biggest problem in Eastern medicine is they are so hung up on getting widespread acceptance. There's this ego battle going on between Eastern medical practitioners and Western medical practitioners that Eastern medical practitioners are not willing to say, oh, hey, by the way, this treatment actually sucks.
Okay, that's interesting, because I wonder, like, if that is a little bit more of an American thing. My experience in China is that Chinese people take a much more shared critical evaluation of both Eastern medicine and Western medicine, where we don't consider Eastern medicine to always be the best for all ailments. For example, by the time that you have like pretty late stage, tumor growth or something like that, or anything that requires a surgery, Typically, that would very much recommended that you go to a Western medicine doctor. A lot of times, actually, a lot of drugs, for example, drugs that were being taken during COVID times or just for colds and flus in general, had both Western and Eastern medicine components within it at the same time. You would have NSAIDs complemented with some herbs, right? But fundamentally, like, if you were to say, okay, are interventions effective in traditional Chinese medicine? That's very hard to say. It is there's a certain degree of a personalization and subjectivity to the actual application of the medicine. So for example, in the West, if you had any sort of ailment, you went to the doctor, you might not even have to go to the doctor. You can pull up WebMD and there's gonna be like the same 4 drugs that you can use for treating this. And they basically apply that to everybody. In traditional Chinese medicine, let's say you went and got herbal treatments. You could get like 20 different formulas from 20 different doctors because they're all going to read your body's composition and disposition slightly differently. There are a lot of similar ways to achieve the same result. So for example, you know, you can think of herbs similarly as you think of food, right? It's just a more powerful form of food, and therefore we call it medicine. And so like, if you wanted something that was anti-inflammatory, that's a great example. You could eat a bitter melon, but you could also have some tea. Both of those have anti-inflammatory properties. So if you went to a dietitian and they wanted you to have less inflammation, would they have, you know, recommended you make a kale salad or a bitter melon, you know, dish or drink tea? Like all of those are kind of different pathways to the same cause. So you can think of the same with like herbs. Is like, okay, if someone has inflammation, there are a lot of different types of herbs that we can use to treat that inflammation. And the complicated thing is you never want to get prescribed herbs in like as one. This is the difference between if you bring home a book that is literally an encyclopedia of herbs and you just go through it and read, oh, this herb is good for a blah, let me go take that. That herb is good for blah, let me go take that. Like you take one herb at a time. That is actually something you have to be very careful about. And this is why Chinese people don't really self-treat themselves with herbs. They actually go to doctors very commonly. Or they'll buy pre-made herbs, but it's always in the form of a formula. It'll have like 6 or 7 or 8 or 10 or whatever different herbs mixed together, because each herb has like different types of properties. And so although this might be anti-inflammatory, it might actually have another impact in your body. And so they'll have another herb to counterbalance that. And then the reason that you're having inflammation in your body is actually because of like 5 different things that are happening in your body. So they're gonna have a combination of herbs to treat all the different kind of pieces to help, again, bring your body back to that yin-yang piece, right? So it's very hard to say, like, if you were to set up a study, like, what is the right herbal formula to pick? If you go to different acupuncturists, you'll notice that you go to them with the same ailments, they will actually give you different acupressure points because they might focus on treating different parts of your overall body first. In reality, a lot of us think that we just have, when we're sick, we think we just have one illness. That's actually wrong. You actually probably have like 8 different things happening at the same time. You just don't notice it. But the doctor is going to notice that, like, hey, your pulse is wrong. Something is off with your pulse. Something's off with your tongue. Something's off with, your skin, your hair, your emotions, the way you write. Like something is cold in your feet, and then blah blah blah, and you're like, I literally just came in here because I had arthritis, right? But they're going to notice all those different things and say like, oh, there are a lot of different things that are out of balance here because the way that the human body is understood through traditional Chinese medicine is there's a lot of different organ systems, but the complicated thing is they all impact each other. And so it's like anytime something goes wrong, inevitably there'll be like 5 other things wrong. And so it's like, do I treat this organ first and complement, kind of support the other organs a little bit? Or do I treat that organ first and support the other ones a little bit? Or do I do a little bit on all the organs at the same time, right? And so you can get a lot of different variations in terms of the herbal formula that you get, the acupuncture that you get, And the best medicine in traditional Chinese medicine takes into account things that are outside of the individual person as well. What is your social life like? What is the climate that you're living in like? This is why a lot of people, they move to other countries and they have this thing called, Chinese we call 水土不服. It's like you're not adjusting well to the water and the soil. It literally just means like different climates, people's body reacts differently, right? And so all of these things are taken into consideration when you design a treatment for someone. So it's very hard to, I would say, like, then say definitively that, you know, this thing doesn't work or is bad, like Dr. K is saying, versus this thing is good, like Dr. K is saying. It's easier to point out a lot of instances where it works well, but just because it didn't work in one specific instance doesn't mean that it's actually bad. It may just be because some piece of it wasn't taken into consideration, and therefore the knowledge and skill set of the practitioner wasn't good enough to actually do a really good job here. But maybe you went to a different practitioner and they were able to get much better results for you, even though the underlying philosophy is the same. It's just their ability to diagnose and pick out all those different pieces and come up with this master plan. Like, it's kind of like how good of a philosopher they are, right? Like, it's reflected in the quality of the outcome. And I think that's one of the things I would say, my approach to Eastern medicine is I don't expect it to treat everything for me. I don't expect it to be end all be all. I very much use Western medicine when I feel like it's appropriate or I need to, the side effects are manageable. I am a big proponent of therapy. Like, I think that therapy is a really powerful tool. And so I'm not saying like go all in on Eastern medicine, but I always say one of the benefits of Eastern medicine is a lot of the treatments are very low cost, and we can talk about this in another video. And most of them are very side effect free because they're really just supporting your body to help reach its fullest potential. And there's a lot of safeguards in place, right? Like, there's different we give formulas of herbs so that not one herb will result in all these side effects, because we have other herbs that counterbalance the side effects of the herb to a certain extent. So I would say it's much more one of those things, like, I would take the mentality of saying like, hey, if I have like all these things that are bothering me in my body, like, maybe don't give up. And maybe like, if I haven't been able to find a good, that's one of the challenges. The other challenge is like, I don't know about Ayurvedic medicine, but traditional Chinese medicine, for example, it's, again, when you really get into it, it's much more almost like a philosophy than it is just a medicinal practice. So how do you prove or disprove, how do you say that like a philosophy is wrong, right? Philosophy is just a way of looking at the world. So for example, how do you say yin and yang is wrong, fundamentally? How do you say something like a metaphorical 5-organ system within our body is wrong? So it's interesting because I think that, I don't know if Dr. K is trying to appease Dr. Mike here when he says like, absolutely, I think that what's going to really help Eastern medicine get on the map is more willingness to say that we're wrong, etc. I don't know if he's trying to appease Dr. Mike or not, but in my imagination, this is actually a very difficult thing to do. Actually, I'm starting a podcast where I have elevated intellectual conversations with complementary and alternative medicine practitioners, because I think that it's pretty hard to find quality conversations, I would say almost produced like Andrew Huberman, Chris Williamson style on the internet. One of the interviewees that I have coming up in a couple months is going to be with someone who is doing research in this space and applying statistical analysis to Chinese medicine. I think that would be a really interesting one to listen to if you find this kind of stuff interesting, so drop a follow.